Good morning. I wanted to take a few moments to interject a little bit more fact and reason into your morning. So, what should you not be feeling right now? You should not be feeling overwhelmed, anxious, fearful, and hysteric. You should not be feeling like the sky is about to fall on you and crush you. You should not be feeling like a virus is trying to crawl through your windows at night or up through your garage door. That might be a raccoon or a burglar, but it's not a virus. You should not be feeling like you're going to wake up in the morning and a zombie apocalypse is going to have occurred and you need a shotgun and bad things are coming through the windows. No, you should not be feeling like there are black crows in the sky and it's a bad omen and there's a blood moon, because there's not. It's not how you should be feeling. Those are emotions and they're real, right? But they're not necessarily factual, and it's not what's probably going to occur. Because if you actually look at the data that exists, we're not talking about projections. Be very careful of those projections, because projections are just that. They're perceptions of what may occur based on certain numerical data and statistics. And as we know, statistics are far from perfect. Just like the weatherman can't even predict what the weather will occur with any consistency. So for us, you want to look at those statistics and go, okay, this is worthwhile to look at. We need to be aware of this. We need to be thinking about things for the future. But they are not definitive science, and they are not factual evidence. So what we should be looking at, the best thing is to actually look at the countries that have been exposed to coronavirus the longest and see what really occurred in retrospect, meaning looking back and saying, well, what did occur? This is what we thought would occur, and this is what occurred. And why did it occur? And how can we modify that for ourselves? So if you actually look at the data out of China, out of Italy, out of South Korea, out of these other countries, right, what do you notice? Well, in 80 to 90% of people, coronavirus is essentially a non-entity. It is a non-event. It is a mild cold that is absolutely boring for the overwhelming majority of people. Now, in 10 to 20% of people, based on the evidence that exists, it's an issue. And it can be a significant issue. It can even be catastrophic and lead to death. Now, death is part of the human existence. It's very crucial that you and I are aware of this. This coronavirus has brought to the surface for everybody to think about. But what really occurs day in and day out? You walk into an ICU anywhere in the country and you see people on ventilators and you see people who you're having to put on masks and gowns to deal with. This is occurring on a daily basis. And hopefully this experience with the coronavirus will improve your empathy for those who struggle with disease. But the reality is that in the last 4 months, the coronavirus has been around. Over 500,000 people have died in America from just heart disease, diabetes, cancers, common pneumonias, and car accidents. 10,000 people have died of car accidents. So when we look at the statistical numbers, it's important that you really think about what's most likely to kill you right now, and that you worry about that more than you're worried about something that is very unlikely to harm you. So let's get back to it. In that 10 to 20% of people, this is a real issue. And when we look at the data, 98%, for example, in Italy, of all those who died were people with multiple medical comorbidities, meaning multiple other diseases, right? So what you and I should be thinking about is saying, well, what are all those diseases? And how do I reduce my risk of those diseases? And how do I protect those people who have all those diseases so they're less likely to die? Because I love people and care about them. So when you look, that's where you practice appropriate physical distancing. You practice appropriate, excellent personal hygiene, etc. But don't lose sight of what's really going on here. Viral particles have been around since millennia. The human person is exposed to them over time, and a percentage of people have significant illness or death from them. This ends up culling the herd, if you will, that those who are most sick or most at risk end up with significant problems. What our goals as a society should be is to reduce as much as possible the effect of this virus on those people who are most at risk. But if you are not that person with all those medical comorbidities and that immune compromise due to advanced age, then there's no reason for panic. There's no reason for fear. There's no reason for all the anxiety except for what's going on in the economy. So really important you dial this back. But it's also equally important that you look at the data with regards to your own risk. So putting it on the internet, videos of you cooking big fatty steaks and loaded up with cookies and ice cream and all this, you're compromising your health and you're increasing your likelihood of getting and dying from coronavirus. Why? Because you're increasing the likelihood of all the comorbidities of obesity, diabetes, high blood pressure, heart disease, all of these things that have been shown to increase your risk of severe illness and death from coronavirus. So let's get back to being rational and reasonable. The risk for the majority of people of significant illness from this is low. Now, I know those of you who are naysayers are going to go, well, what about this anecdotal story of John who was totally healthy and suddenly died? He was only 46 years old. And, well, first of all, the majority of those stories, if you look at them, there's some underlying predisposing thing. Somebody had leukemia 2 years ago, or the person was admitted to the hospital or something else and treated and got a pneumonia, and then they were also COVID positive and died. But in addition, don't forget, genetically, some people don't do well with certain viruses. And that's why they're going to be those outliers, we call them, those unique cases. But that doesn't mean that it's the majority of us that will be like that. That's not what the data says. So, what does this mean you should do? It means you should take a big breath. You should take another big breath. You should then look at your personal risk based on the scientific data that exists to date, not in projections. And you should set up your life in such a way that you reduce the amount of risk to those around you and the rest of the populace, and that you reduce your long-term risk of death from common diseases as well as from uncommon viruses. Because let's be very clear, over the last 20 years or so, we've seen more and more of these sort of viral issues, whether it be SARS or H1N1 or MERS or any of these. This isn't going to stop tomorrow. This isn't going to end with just coronavirus. There are going to be more viral particles that are exposed to humans over time, and as a result, end up causing disease in a small percent of the population. Your goal then should be the following: to improve your general health, to maximize your immune function, to optimize your overall global whole health so that your immune system is as functional as possible, you have the least number of total medical comorbidities, and you're ready to be exposed to some viral particle, to rapidly process it, producing antibodies, and to then be resistant to that form of that virus the rest of your life. So, stay positive today, make intentional decisions to improve your general health and your immunity with every bite and every movement, and please, leave the emotions for fun, playful, enjoyable things. Don't bring the emotions to the table for this. They have no place here. So if you struggle with anxiety or depression, it's time to turn the internet off, to close the computer, to turn off the cell phone, and to spend time in nature. Look outside. There's a blue sky, the green leaves. Spring is coming. If it's not there yet for you, it will be soon. And the earth will continue to turn. The sun will rise and set. The birds are still going to go into mating season, and it's going to be a beautiful blessing. Make it a blessing for every one of the people around you today. Spread joy, compassion, and empathy, and stay healthy.